Knock knock. My name is CJ. I'm gonna be your student nurse for today. Your physician has ordered these medications for you, and I'm just here to administer it. If you have any questions, just let me know. Provide for privacy, and then I'm gonna go ahead and hand hygiene for 20 to 30 seconds. Alright. And then, may I get your name and date of birth? It says you are allergic to latex and eggs. And then Delaney Karen, 8/19/1966. Okay, and it matches. Alright. And then I'm just gonna go ahead and it says you're allergic to latex, so I would use a non-latex glove. And then before I start the medication administration, I'm just gonna say the 6 rights. So make sure that they have the right patient, right dose, right medication, right time, right documentation, and right route. Some gloves. And then how are we doing, Delaney? Everything okay? Awesome. And then I'm gonna go ahead and make sure that the bed is within working height condition. Great, and then I'm just gonna go ahead and administer the medications first, so ampicillin, but before I do that, it's IM, so I'm gonna show where IM medications would go. So it'd be on the deltoid, so just right below the acromion process. I would put 2 fingers just below it, administer it right in this area, and also on the vastus lateralis, so lateral side of the leg, just 4 fingers below the scapula, and just right above the knee, and right here. I could give it anywhere in this area. And then your ventrogluteal, so it would be just right here. I would just make this angle right here, just between my index finger and like my thumb. Right. And then since the medication is gonna be ampicillin, I would not put it on the deltoid area. So I would do the vastus lateralis for it. It's a bacterial medication. Alright, and then I'm gonna go ahead and clean the site for 30 seconds. Go across, below, circular motion. Alright, this goes to trash. And then I've got my ampicillin. Right here, 2 mLs. And then IM injections, I'm gonna do the Z-track method, and then you can go from 45 to 90-degree angle. So I'm just gonna go straight up 90-degree angle. Okay, and then administer it. I'll do it slowly, and then leave it for at least 10 seconds in the patient's skin, and then remove it, and then this will go in the sharps container. Right. And then I would put cotton ball and then tape it on the patient's skin to prevent from bleeding. And then I'm gonna go ahead and administer Humulin R sub-Q. So that will be insulin. And I've got 4 ml or 4 units of insulin, because on the sliding scale it says that if the blood sugar is between 201 and 250, I would get 4 units. So right here, and the patient's current blood pressure or blood sugar is 242. And then for sub-Q injections, it will go on the patient's abdomen, just within like 2 inches around the umbilical area. And then I'm gonna go ahead and just pinch the site or clean the area for 30 seconds again. And then insulin will help lower down your blood sugar, blood glucose. Circular motion. For at least 30 seconds. Is everything okay? Delaney, Mrs. Delaney. And if you feel any pain, just let me know, okay? Alright, and I've cleaned the area for 30 seconds. I'm gonna go ahead and get rid of this. And then I'm just gonna pinch the site just a little bit. And then I could administer it 45 or 90 as well, but I'm gonna do a 90. Okay, 4 units of insulin. Alright. This will go in the sharps container. And then I would put cotton ball and just put it on the patient's side. Right. And then physician has ordered a TB skin test as well. So for TB skin test, it's just to test if you've had tuberculosis before or you've been exposed to it. And then after I administer the tuberculin, patient should come back within 48 to 72 hours just to read the site. So I will go ahead and clean this one again. And then for tuberculin, let me just clean this for 30 seconds. Circular motion, all kinds of motion for it. Just make sure that the skin is clear. Alright, site's clean. And then I would let it air dry for every part of the skin that I've cleaned. And then I'm just gonna go ahead and show the camera where I would do the tuberculin. So it'll be on the patient's arm right here, and then just below the antebrachial and just above the carpal. So like right in this area. And then I would put like 4 fingers below and above it and just like in the middle. Right, and then I've let the area. And And then I've let this area air dry. So I'm gonna go ahead and administer it just like 15-degree angle. Make sure that the bevel is up. And then 0.1 mLs of it I administered. And then this will go in the sharps container. And then I've got the bubble for it. And then yes, so I would just, patient teaching, I would tell the patient to come back within 48, 72 hours so that we can read the site of where the area was. And then lisinopril, alright. Do I have anything else? And then I'm gonna go ahead and do labetalol for, it's a beta blocker. So it's just to lower down blood pressure. And it says right here, if systolic BP is greater than 160, I would administer it, so I would. And then I've got my labetalol right here. It is right here. And it's for IV push. So I'm gonna go ahead and go to this side. Make sure you can see. Alright, so for this one, I would make sure that I clean the port 30 seconds. All kinds of motion. Alright. And then it's been 30 seconds, so I'm gonna go ahead and throw this wipe away. Make sure I hold it. And then before I administer the medication, I would flush the port first. So I'm gonna flush about 2 to 3 mLs. And then I'm gonna unclamp this part. Flush it. I flushed about 2 to 3 mLs. I would remove this. And then I'm gonna go ahead and administer the medication. So just so you can see, right here, 2 mLs of labetalol. Slowly, and it says 10 minutes on there, if I'm not mistaken, so I would push for that long, just slowly. Okay, and then it's been 10 minutes, so I'm gonna go ahead and remove it. And then I'm gonna go ahead and flush again. And then, let's say I put the medication that I administered was 2 mLs, so I would flush 2 mLs. Alright. And I've flushed 2 mLs, so I'm gonna remove this flush and then make sure that I clamp back the port, and then I'm gonna go ahead and clean the port again for 30 seconds, just to make sure. Alright, and then I'm gonna go ahead and get rid of this, and then this will go in the sharps container. administer the PRN and PO meds. So just gonna make sure the patient's okay. And then I'm gonna raise the bed. And then at about 45 degrees. Okay. And then before I administer any medications, I'm gonna go ahead and make the patient drink some water first and make sure that they can swallow and that their gag reflex is intact. So patient can swallow, so I'm gonna go ahead and administer the PO medications. So it says lisinopril, 20 milligrams. I've got my lisinopril, 20 milligrams that I would administer. And then just give this to the patient. When the patient takes the medication, I'm gonna go ahead and make her drink some water afterwards since it's not sublingual. And then I'm gonna go ahead and administer acetaminophen. So I've got 10 mLs for this one. So I'm gonna make sure that I pour it on a table where I can see it on an eye level. If I can open this one. Okay. Okay, I've got 10 mLs. If I were to put this on a flat surface, it should be 10 mLs. And then I'll tell the patient to take it. Might taste a little bitter, but it shouldn't be too bad. And then patient took it, and I would just give water to the patient. There you go. And then lastly, fluticasone nasal spray. So it's just to help the patient breathe better. And I've got the fluticasone right here. And then I'm gonna go ahead and administer it. And then I'll tell, before I administer this one, I'll check the patency of patient's nostrils. So I would make her like push on one nostril on each side and see if she can breathe better on one or the other. And then let's say the patient's left nostril. So it says spray on both, so I'd spray on both. And then tilt their head back. And I count at 3, I'm just gonna spray it. Okay. Make sure that the patient is okay. And then I'll go on the other nose as well. It says 1 spray each nostril daily, so there you go. Alright, and then that should be all. I'm gonna go ahead and remove my gloves and then clean up after myself. So make sure that everything's cleaned. And then make sure that the patient's comfortable, everything's okay. I'm gonna go ahead and lower the bed down. And then if the patient prefers to be in this like position, a Fowler's position, a little bit high Fowler's, I'll just leave the patient in this position so that, you know, because we just administered the nasal spray and she could have a hard time breathing just when lying supine. And then I would make sure that the call light's within reach. I with hand hygiene for 20 to 30 seconds. And then I'll make sure that the bedside table is within reach as well. And then the privacy curtain. And then that should be all.